أهلا بيكم. في خلال آخر مؤتمر لل A4M اللي هو الأمريكان أكاديمي أوف أنتي إيجينج ميديسين اللي أنا حضرته في لاس فيجاس، قدرت أكسب وقت وأعمل انترفيو أو مقابلة مع واحدة من أكبر الدكاترة المتميزين جدا في مجالهم. المقابلة دي كانت مع الدكتورة فلوتورا هارولد. اسمحوا لي إن أنا أشارك معاكم نبذة بسيطة من السي في بتاعها. دكتورة فلوتورا بدأت كطبيب أسرة، وبعد كده تخصصت في العلاج بالهرمونات الطبيعية لما عملت بورد في طب مكافحة الشيخوخة اللي هو الانتي ايجينج ميديسين، اللي بيها قدرت انها تشتغل مع جميع الاعمار ورجالة وستات فبعلاج الهرمونات اللي هي تخصصت فيه، وبقت فانكشنال ميديسين دكتور او تخصصت في الطب الوظيفي. بتقدر تعالج حالات الأندروبوز والمينوبوز والبيريمينوبوز اللي هي مشاكل السيدات بالذات اللي بتبقى قبل انقطاع الطمث أو في خلال فترة انقطاع الطمث. ده تخصصها وده شغلها. كمان في هذا المجال هي متحدثة في المحافل العلمية اللي بتختص في العلاج بالهرمونات. دكتورة فلوتورا جميل فيها جدا إنها كمان مدرسة يوجا وبتمارس الإيروفيدا، بتشتغل جدا مع الأثليتس أو الرياضيين في طب تحسين اللياقة البدنية. دكتورة فلوتورا متخصصة في علاج الإجهاد الجسدي أو إجهاد الغدة الكظرية أو بنسميه بالإنجليزي اللي هو الأدرينال فاتيج. فليه كمان بروتوكولات. دكتورة فلوتورا شاطرة جدا في إنها تعالج الأمور دي بالعلاج مع الهرمونات والبيبتايدز الحقيقة. ليه؟ لأن دكتورة فلوتورا هي عضوة في الأمريكان أكاديمي أوف أنتي إيجينج ميديسين وزميلة، وفي نفس الوقت هي عضوة في الانترناشونال بيبتايد سوسايتي اللي بيعالجوا كل الأمراض دي بالذات في الطب الوظيفي. يلا بينا للانترفيو.
Such a pleasure to meet Dr. Flu again this year in the A4M. I cannot express my happiness to meet her and discuss a lot of points and things and take home messages from the A4M this year. We will share some exciting learning with you guys. Hi, Dr. Flu.
Hi, Dr. Noah. I'm very good. So good to see you again here after Orlando.
Yes.
We are like the veterans of all events of anti-aging. So now we need to share our wisdom.
Yes, please.
Yeah,
please.
yeah,
so I know you're tired after full 4 days of, like tons of education.
It's a lot. It's a lot. Yeah.
Which is good. Science is amazing. Anti-aging field and medicine never, stopped.
Yeah.
And this is what I want to ask you about today. Like, how do you see the anti-aging medicine? Is it only aesthetics, dermatology things, or real medicine that will cure people?
Yeah, so Dr. Noah, has been really exciting to meet you again here, and it's really fantastic to share these topics together, because one of the key things for us and what is so innovative about these anti-aging events, take away home, is aging is evitable, is avoidable. We don't need to age bad. We can age better. We can have more energy. We don't need to struggle with brain fog. We don't need to suffer from so much stress. We can manage all of those. We can decline all these cognitive processes. We can diminish those processes. We can help reparation of our cells. We can help our metabolism to function better. This has been really amazing to learn the new innovations, in this field. Yeah.
Actually, in such conference, they cover everything. Like, they cover how to test your patients, how to go through the epigenetics. That was exciting a while ago.
Yeah.
Like, for example, diagnostic-wise and epigenetic-wise, you can know if this body will have acne. That's simple.
Yeah, exactly.
If the body will metabolize the testosterone in a proper way or not.
Yeah.
If the body will have cancer, even if there is a family history of cancer. So the anti-aging medicine and really learning from A4M is something like great. Every year there is something new.
Yeah.
And actually, what do you advise? Like, where do we start? How can we start? What's your advice?
So, first and for all, we really need to check the homeostasis. What is the current situation of this body in every age? How is functioning? This is not anti-aging only for above 40, above 50. This is aging well and functioning well. So it's regenerative more than everything. You talked about the epigenetic tests. Really, I'm very keen about, and there are a lot of players out there on the age diagnostics field when you can understand your biological versus chronological age. But what I like more is even the genomic data around that, understanding what's your cancer risk, how is your cells aging, and understanding how can you help them, and what are you doing wrong versus what you're doing right, food-wise. So you start always with a questionnaire. So usually I make my patients, fill in some sometimes sort of long questionnaires, but necessary. And we understand all questions like how they live, what they take, and what problems they have. And then a series of lab tests, which is so important that will lead to some way of treatment for this person. I'm very keen to say that there is solutions out there, and we all can heal ourselves inside out.
Exactly. And what else did you get this year?
I was very surprised, nicely surprised, that there was very much more new information and new studies around use of testosterone for men, that there is strong improved patient outcomes. That you really always have to check the PSA levels for men, but this study that secures that using hormones like testosterone therapy, for example, is safe. Some other things that really attracted my eye was nitric oxide and the publications supporting how the use of different products like arterosil, for example, for supporting your arteries and trying and helping with coronary disease or heart disease. The use of nitric oxide is powerful. There is a lot of other ways for understanding the way how we detox, the medical detox, the anti-aging detox, the way how we do it, like through patterns of diet, food, combined with using the right hormones. And I would ask you, what do you do for your skin? Because you look amazing.
Thank you so much. Actually, what I advise everyone with, in my main two things that I use morning and night. Morning is my estriol 0.1% cream.
Nice.
And there was a study actually for the anti-aging, anti-wrinkle effect of the estriol E3.
I saw
and
that.
I love that one. At night, this is really continuous. As soon as I got the information from Dr. Hertoghe about the melatonin oil, he has a great formula that I tried, and it really works. So that one is the melatonin that I apply at night, melatonin oil with all the organic, the other organic ingredients, and the estriol. That's all.
Nice.
Yeah.
I believe you and me, Dr. Noah, are one of the fewest doctors in the world that come from the training of both best worlds in Europe and in America.
Yes.
So we are both going through the certifications with Dr. Hertoghe and with American Anti-Aging Medicine. It's not nothing to fear. If you need hormones in the right way, you go to the right doctor.
Exactly.
Nothing to fear.
Thank you for saying that. Bioidentical one, and if it's under strict doctor supervision, following the prescription really properly.
Yeah.
And sometimes people, when they feel great with their medication, they just increase the dose their way. So this is not also recommended. They should follow what's there in their prescription.
Yeah.
I can guarantee 100% safe utilization of the BHRT and amazing outcome from these medications.
Definitely. One of the key things for me in this event has been as well the news and the new studies around how to treat patients with heavy metals and toxins. We really touch more than 200 kind of toxins and plastics and BPAs and phthalates, which are very dangerous for us. So really, applying those learnings on the field of toxicology and how to deal with heavy metals, and specifically with the food allergies, and what's the right diet and what's the right exercise together with the right amount of hormones to support your body, has been my secret formula to share with my patients.
Thank you again for this point, because not all of the people, or not even all the doctors, know about this heavy metal detox. And I believe that nothing will work, no treatment will work unless the body is detoxified from the heavy metals. So actually, we need to talk more about these points. We have more.
So this this video,
like tackling each and every point of this
Let's
interview.
do that. Yeah.
And raise the awareness and educate people about these things. Let them really explore these things from their sides, do their homeworks, and then come back to us with any questions that they need. We are really willing to help everyone. Thank you so much for your time. Thank you, Doctor, for your time. All the best all the time, and see you in next session.
Thank you so much. Thank you. Thank you.
شكرا. أنا يعني سعيدة جدا بلقائي مع الدكتورة فلو، وإن شاء الله نعمل حلقات نجاوب فيها على الأسئلة دي. كل عندكم أي أسئلة بعتوا لنا، وأنا من ناحيتي كصيدلانية أساعد، ودكتورة فلو إن شاء الله تساعدنا من ناحيتها كطبيبة، وإن شاء الله يعني نفيدكم ونجاوب على كل أسئلتكم. أنا نهى شلبي، صيدلانية مصرية. Stay tuned, stay unique.